Hey everyone, this is round two. My name is Dr. Patrick. I'm a physical therapist in OC, California, and this is our Sunday talk show. This is our guest, Casey.
Hello.
Today we are going to be going through pelvic health and what to do to ensure good pelvic health and a good pelvic future. So, Kathleen, can you tell us a little bit about yourself and what's going on?
Yeah, so my name is Kathleen, and I'm in my later 20s. Over the last couple years, I've been really diving into my health, what I can do to improve it overall. And so today, Dr. Patrick is going to be doing a physical therapy assessment with me. I've always kind of had problems with my hips. One tends to be higher than the other, and that really affects me during my strength training. So that's something we're going to be going over today, right?
Yeah, and something that we didn't really talk about before, or at least at the last live, is Casey wants to be a mom. And so something that's important with pregnancy is that during the 9 months, the ligaments around the pelvis start to become more lax or loose, and so essentially what I'm saying is the static stabilizers are since they're becoming lax, you want to rely on the dynamic stabilizers, which are the muscles. So if you can strengthen and engage the pelvic floor, you're going to make your life a lot easier. So, Casey, you brought over an X-ray for us, or
I did.
Well, it was imaging, right? Mm-hmm. Okay, why don't you describe the imaging to us?
So one of my hips, like I said, was a little higher than the other. So when I'm squatting, doing different movements in the gym, I'm definitely not doing it the way I'm supposed to. So that's been something that I've been working on, and then also just like a regular x-ray of your pelvis, kind of like, I don't know, looks like this, maybe. And one of my hip bones is kind of turned inwards. So there's something going on there, basically.
So another way of saying that is, hello everyone again. So instead of her hips both being kind of in a neutral position, one of her hips is more in an internally rotated position. Mm-hmm. And so really the big goal here is we want to have neutral everything, right? Every joint. We want our back to be in neutral. We want our neck to be in neutral. This is the same thing with our pelvis. We want our pelvis to be in neutral. Mm-hmm. If it's not in neutral, then you're going to have some sort of imbalance.
Got it.
So today we're going to start with assessing her pelvic range of motion. But before we do that, just kind of doing a quick little intro for you guys, in case anyone's new here. My name is Dr. Patrick. This is our guest, Casey. We're doing a show today. We'd really appreciate it if you click the center button that sends us to the For You page, and then that kind of helps our business get out to everyone else. If you guys have any questions, please throw it in the comment section, and we'll get to you, okay?
And also, thank you so much for the likes, guys. We really appreciate it.
Okay, so first things first, we're going to have Casey lie down on her back.
Can I have up here?
Yep.
Okay.
The green screen doesn't work. How do I turn off the effect? Oh wait, let's see.
If anybody has any pelvic related questions, please drop them below, and we will go ahead and make sure to get them answered for you.
Okay, so first things first, I'm going to be assessing her hips and then her back, okay? So go ahead and lie down. Okay, so we are going to start with her left hip right over here, okay? We're going to bring her knee up. Okay, so this is the neutral position. We're going to go into external rotation first. So, looks like she has plenty of external rotation. We're going to go into internal rotation. and looks like she has a lot of internal rotation. So good range over there. We're going to go into flexion. Flexion is going in this position. She has very good flexion. Hey, something to actually bring up. Did you say you were hypermobile?
No, but I wish I was.
You are? Okay, what did you say earlier?
Hyperlordosis is what I have.
Okay. She has hyperlordosis according to her imaging. That's just a postural note. Okay. We're going to go into extension. I'm going to have you bring this knee up.
Okay.
You're going to hold it up here with both hands. I'm going to bring this just a little bit closer. There we go. I'm going to bring this leg down. And then come a little bit closer here. There you go. Sorry. Okay. There you go. We're going to bring this down.
Bring it down?
Oh, no. Hold this up.
Okay.
And then I'm going to push down. So relax. Okay. So here, you guys can see, here's the femur, right? Here's the center point. Okay. You can see it going down. So that means she has good extension. Okay. So her flexion, extension, external rotation, internal rotation, all really good.
Also, I think this is the hip that's like good.
Okay, so
right where it should be.
So hey, that's the hip that's good. So now we're gonna check out the other side. By the way, guys, if you guys are tuning in, my name is Dr. Patrick. I'm a physical therapist in OC, California, and we are treating Casey's hip/pelvis. I'm gonna have you turn around the other side.
Hello.
Okay, so we're gonna start with flexion, guys. So we're gonna go up.
Thank you for the likes.
Oh yeah, I can actually tell a difference here.
Mm-hmm.
It's not as smooth. The other, on her other side, her hip just kind of went straight forward. This one, I'm kind of getting a little bit of resistance right here. But it's still at 100 degrees, so that's pretty good. So now we're going to look at external rotation. External rotation is pretty good, so we're going to look at internal rotation. I felt like a click, yeah. So I felt a click in her hip already, so that shows instability. That's a ton of range of motion in internal rotation. So I'm going to run a couple tests here.
Okay.
So I'm flexing her hip up, I'm adducting her hip, and then I'm pushing inward. Any pain there?
No pain.
Okay, this is called the Scour test, so no arthritis or negative for arthritis. Good. So I'm going to check out if her hips and pelvis are aligned. Here's a good question. How do you do that? Easy. We're going to do a bridge. Okay. So I'm going to have you bring both your feet up. Or, lie down.
Okay.
Just like that. And then you're going to bridge up. Come back down. So that resets everything. I'm going to have her straighten both of her legs. Okay. I'm looking at her pelvis right over here. Looking for her hip. Her hip is right over here. I'm going all the way down to her ankles now, and I'm seeing if her ankles are like aligned. So let's do that together. So I'm putting my hands around her ankles. I'm going to pull just a little bit. With the angle, 1 second. So here's my thumb. This is what I'm using as kind of like my indicator. I'm putting it right on her ankle bone, right over here. Here. Right over here. I'm pulling. This means we have a little bit of instability going on. So, hey, good thing she's at a physical therapist, and we're going to work on that right now. So, before we get going, okay, let's summarize her. I would say that she has a upslip on her right side. An upslip just means like her pelvis is higher on one side. Nothing to worry about. And then we also have scoliosis, which is in the imaging to kind of consider. Yeah. And do you notice how she said sometimes her leg is, right? That means that it changes. Like typically leg length does not change. So what this tells us is that there's some sort of muscle stabilizer that's, there's some sort of imbalance with the muscle stabilizers there that are sometimes making it so she feels like she has a leg length discrepancy and sometimes she doesn't. So before we go into treatment, we're going to check out her musculature through manual muscle tests. So Casey, I'm going to have you sit up. And then again, guys, if you guys have any questions, feel free to throw them in the comment section. I'd be happy to answer any of them for you. And then please throw out some likes. That totally helps us get us into the For You page.
Oh yeah, I highly recommend you, let's see, Tracy, if you're still watching, go see a physical therapist if you need a good stretch. Depending on where you live, you might also have like a stretch lab or something like that. So those are some really good options for that.
Okay, so I'm going to have you scoot back just a little bit. Okay, you're fine right there. Yeah, right there. Okay, so we are going to check her hip flexors first, okay? So I'm going to have her bring her knee up to my hand. Go ahead and do that right now, okay? And come back down. So let's reset that, okay? I'm going to ask her to put both her hands to her side. There we go. You're going to do your best not to lean back, okay, Casey? Okay. Bring your knee up to my hand. Okay. Don't let me bring you down, okay?
I feel a pull in my back for some reason.
Check that out. She feels a pull in her back. So this is a hip manual muscle test. That means we're testing the strength of her hip. Instead of feeling it in her hip, she's feeling it in her back. What does that mean? That basically indicates that instead of using her hip muscle, she's using her back muscle and she's compensating. So anything quad muscle. Okay, you're going to lift up again. Okay, you're going to bring your leg down all the way. You won't crush my hand. Okay, bring your leg to my hand. Okay, bend just a little bit. Hold right there. Don't let me move you, okay?
Okay.
I'm going to push down. Perfect. Any issues?
No, not really.
Look at that. No issues at all, and relax. Okay? That is a strong muscle. And then where did you feel that, Casey?
I felt that in my quad.
She felt that in her quad. That's exactly what we're expecting. So we're going to check her other side. So if you guys are just tuning in, so far we have a discrepancy in her right hip flexor. Instead of feeling it in her right hip, she's feeling it in her back. Now we're going to check her quad on her other side. So lift up. Come back down. You're going to extend. You're going to hold right here. Don't let me move you, okay? And dang, she is strong. Any issues there?
No.
Okay, so strong quad, perfect. We're going to check out her her external and her internal hip rotators. So guys, if you have any questions, feel free to throw them in the comment section. We'd be happy to answer them. Please throw us some likes and throw us a follow. We'll be eventually going through all the different body parts. And if you guys stay tuned, next week we will or in a couple of weeks, we will be working with doing an interview with a Stride CEO. So this leg is going to bend.
Okay.
We're going to go this way. Sorry, relax. This way. Hold right there. That's the motion. Don't let me move you.
Oh, that's hard.
Okay. So it's hard. Any pain there?
No pain, no, but I felt it in my hip.
Okay, so the location is correct. That's where she is supposed to feel it. It's just hard. So what does that indicate? That indicates weakness. So no big deal. We're going to try the other side. Hold right there. Okay. Don't let me move you, okay?
Okay.
Okay. Any issues there?
Online, guys.
What's your guys' favorite song? Anyone? Any new songs? It is 2023. I thought my music was new, but I realized a lot of it is from like 2014. Okay, we're gonna bend here. Bend it. Okay. We're gonna bring this in here, out here. Hold right there for me. Okay. Don't let me move you. Okay. Any issues there?
So I didn't feel any pain, but it was a lot harder for me to like not to resist that basically.
Okay. So no pain. What about location, Casey? Where did you feel that?
I felt that in my hip.
Okay, so location is correct. So only issue there is just weakness in external rotation. So we're gonna go into internal rotation. Hold right there. Don't let me move you.
I can't.
She can barely even hold that.
Yeah.
Relax.
Okay.
I'm not even, I like barely even touched that. It was just her getting into that position. So we're kind of getting a couple of clues here, right? So relax. Relax, relax, relax. So her hip flexor is super weak that she's compensating with her back. Her hip internal rotator is also super weak. Her external rotator, it has mild weakness in it. Summary is, it looks, we still have to test her hip extensors, but it looks like her entire right hip not only has an imbalance, but it also has a weakness. Or also has weakness. The question here is the weakness linked with the instability? I don't know. Let's find out. Okay. We're gonna now test out her hip extensors. I'm gonna have you stand up.
Okay.
And then let me raise this guy.
Thank you for the follow. If anybody has any questions, please drop them below.
So in a moment, I'm gonna ask you like, I'm gonna go like this.
Okay. Gotcha.
Okay, so we're gonna do a manual muscle test for her glute muscles. So let's go maybe this angle. Okay, so go ahead and unload your body.
I'm doing it right here?
Yep. So, check. You're gonna like literally like unload.
Got it.
Like that. Yeah, okay. Is that too tall? I'm gonna get lower just a little bit. Okay, bend your knees. There you go. Okay. You're gonna put all your weight on your left leg. Okay, and we're gonna take this leg. We're gonna push it out here. So relax. Hold right there for me. Okay, fold it. Don't let me move you, okay? And relax. Any issues there?
No.
Okay. So no issues with her right side. We're gonna check out her left side. Okay, you're gonna hold right here. Okay, don't let me move you, okay? Okay, and relax. Any issues there?
No.
Okay, go ahead and relax completely. Okay? And then now we're gonna test a couple other things, okay? We're gonna have you stand right there, Kathleen, Casey. Hey, fun fact. Let's all tell a story about each other. So, Casey and I used to work for each other. Hey, Casey.
Yeah.
Why did you used to introduce yourself as Kathleen?
Well, Kathleen is like the name I was given at birth, but Casey stands older than my initials. So Kathleen, Christine, and Kathleen I just felt was like more professional, more business-like, and my family called me Casey, but I like both of them, honestly.
It's 2023. If you identify as Casey, you can be Casey. Okay, so anyways, let's summarize, guys. So, or sorry, one more thing. We're gonna test a couple more things. Casey, I want you to go ahead and stand on one side. Doesn't matter what side. We're gonna test her balance. Okay, guys. We are looking from her belly button, her nose to belly button, and we're also looking at her belt line. We're trying to see, is there any instability? Do those lines break at all? And so far, hey, it looks pretty darn good. We're gonna check her other side. Go ahead and switch. Do you see how her pelvis actually dips a little bit there? And she kind of has a little bit of a harder time. Interesting, right? Like, why would she have a harder time standing on that side? It's very possible that all of these things are linked. Hey guys, welcome to the show. My name is Dr. Patrick. We are going over pelvic health. And check it out. You can see Casey's belt line basically drop in this angle. Can you see that?
Yeah.
Okay, so we're going to summarize everything. So Casey, you can go ahead and relax. So let us bring this back. Let's talk about it.
Sure. Hello. Thank you so much for the likes.
Hey everyone. So we went over Casey's evaluation and assessments, and we went over her range of motion, we went over her strength, and we went over her balance. Let's summarize a couple things, okay? So range of motion wise, what was important was that her right hip was more stiff, right? Like, what's going on there? In addition, her right internal rotation was like, wow, super hyperlax, hypermobility. Like, she has a ton of range there. So something to kind of mention here is that when you have a lot of range of motion, you need to have a lot of stability. If you don't have stability when you have a ton of range of motion, you essentially get instability, which then results in some sort of like pain. So let's go into strength. Her strength issues are basically her entire right hip, right? When she goes into right hip flexion, she compensates with her back. When she goes into right internal rotation, she can barely even keep her leg up there. That's actually pretty abnormal. Let's fix that. And then her right external rotator hip part is just like normal weak. So put them all together. If you think about it, when she's walking and she's weight bearing every time, she can have some issues. So Casey, have you ever noticed, like, when you're hiking or doing something strenuous, like one side just feels like off, or like,
So,
how would you describe that?
It's funny you asked that, actually. So I was doing some walking today, and over the last couple of weeks I've been noticing like a popping in my hips, and I'm getting adjusted twice a week, so I'm also getting adjusted, and after the adjustments I started to feel like this popping and kind of like tightness in my hip area. I can't really pinpoint what area it's coming from, but it feels unstable.
Gotcha.
It does. Yeah.
So if you kind of think about the words that I've been using, right? She has weakness, she has instability. It's pairing up with her subjective history. And so when we pair them all up, it's kind of like leading all to these impairments. Like, what do we have to do? We have to treat the instability, right? We have to treat the range of motion issue, or sorry, we have to treat range of motion by teaching her how to use her muscles within the proper range. You don't want to go into the hypermobility range, right? And then we also want to strengthen all of the weak muscles. So that includes her hip flexors, external and internal rotators. Surprisingly, her hip extensors, her butt muscle, super good. Actually, that makes a ton of sense. She's been taking like a butt exercise class, right?
Yeah. It's I do strength training, and they have a booty day.
Hey, so shout out. So out of her entire hip, her butt is not weak. It's just everything else.
Woo, I'll take that.
Okay, so do you guys have any questions, by the way, before we get going? In just a moment, I'm going to go through a couple of treatments and what Casey needs to do. And by the way, I totally appreciate all the likes. Thanks, guys.
Yeah, it means a lot. 1.2.
Hey, right?
That's amazing.
So my name is Dr. Patrick. I'm a physical therapist in OC, California. And this is Casey, our guest.
Hello.
If you join us in a couple of weeks, we will actually be having the CEO of Stride here, where we will be doing an interview. If you guys haven't been to Stride, it's pretty fun. You do all of your cardio classes basically like with someone running them, and it feels like it's a club.
Yeah.
Okay, so let's treat things one by one, okay? So one of her first issues was her hip flexor. So instead of feeling it in her right hip, she's feeling it in her back. So we're going to show her a transverse abdominis core workout / dead bug. Okay. So Casey, let's have you lie down on your back. Oh, hey, check it out. We are having people watch from the Philippines. Thanks, guys.
Awesome.
Appreciate it.
I'm getting up here?
Yeah.
Ugh. Alright. What is the name of this?
It's called the dead bug exercise.
Okay.
So first things first, the most important thing, she needs to learn how to engage her core muscle. So Casey, I'm gonna have you face that way,
Okay.
and then you're no, with your face, with your
got it.
face, and you're gonna cough like that.
Okay.
So by coughing, it automatically engages your core muscle. So go ahead and relax now. Okay. Can you engage it like you were coughing without the cough? Yes, exactly. So now she's kind of pushing her stomach out. So while you're holding and maintaining that position, okay, you're going to bring this leg up into a 90-degree position.
Okay.
Okay. Now you're going to bring this leg up into a 90-degree position. Okay. Now you're going to bring this down. And then you're going to bring this down. Okay. Don't let go. Okay.
Don't let go?
Don't let go of this.
Oh, got it.
Okay. Otherwise, you're going to feel it in your back.
Yeah.
Okay.
Got it.
So while she's doing that, I can already feel the instability. I can already feel her right leg shaking, and so that's completely okay. What that's indicative of is weakness, and so as she's doing this every single day, every single week, she will feel stronger, and as she feels stronger, she'll feel more stable. Sorry guys, heartburn. It's what happens when you turn 31. Okay, so Casey, we're going to have you do 15 reps of this, okay?
Okay, is it 15 like alternating?
Yeah, so it goes like...
So is it bicycles?
No.
Uh-huh.
You're going to go like this, 1, and then go up, 2,
Okay.
and then bring this down, and then bring this down. Good. Now bring this up. There you go. Good. 4, 5. Good. Make sure to hold both of them for like a moment. Okay. And she's doing a good job where she's engaging her core the entire time. Hey guys, thanks for joining in. My name is Dr. Patrick. I'm a physical therapist in OC, California. We just went through Casey's evaluation here, who has pelvic instability. We are showing her stability exercises. First exercise she's doing is called the dead bug. Most important thing here is engaging the core muscle. By doing this, we are going to take away the compensatory back pain that she's having. What number are we on, Casey?
12.
She's on 12. Casey, how hard is this? Or easy?
It's getting harder.
It's getting harder. Surprisingly, right? Doesn't it look easy?
And I feel like a tightness in my hips.
And she feels a tightness in her hips. Okay.
But I don't feel it in my back.
Good. So it's easy to get caught up when you're at the gym. You're trying to lift like hundreds and hundreds of pounds, or maybe more like 40 or 50 pounds. But really, everyone should start at the at body weight exercises and then progress from there. That's my cat, by the way. Okay, so Casey, what I would tell her is she should do maybe 2 sets of 15 every other day, every 2 days. Okay. Okay, so that fixes her hip flexor issue, okay? What else did I say? She has an issue with her hip internal rotation and hip external rotation. So what can we do here? Okay. So hip external rotation, right, is the glute med. So what I'm gonna have her do is I'm gonna put a band around her knees, and we're gonna have her do bridge exercises. That basically engages that glute med exercise, okay, or glute med muscle. So give us a moment.
Hi everyone. Thank you for the likes.
Guys, we appreciate it. If you're just tuning in, we'd really appreciate you hitting the center button and throwing us some likes. By hitting the like button, you're helping us grow our page out into the For You page and getting more people. Thank you. We appreciate it. It's a family business. Thank you. We're going to put this around her knees, ankles, knees. And then we're going to tie this super tight.
I actually warm up with these at the gym every leg day.
She's such a beast. Okay, you're going to push down, you're going to lift up. Okay, you're going to hold there, and then you're going to open up. Sorry, stay up.
Okay.
And then open up your knees.
Yeah.
Yep, and back. Yep, just like that.
All right.
You're going to do 10. There you go. 4, 5. So, you're going to look at her hip here. She's going to try to keep this hip up, trying to basically keep this straight line here. Okay? The main goal here is she should not feel any pain. If she feels pain, she should let us know, and we're going to modify her parameters. Good, and come back down. That's what you do at your gym warm-up already?
Yeah.
Okay, so then we're going to give her something else in addition to that. Ooh, actually, we'll give her some sliders.
Oh.
So Casey, I'm going to have you go onto all 4 position. Okay. We're going to go, do you know fire hydrants?
Yes.
Exactly. So you're just going to touch my hand, right? Exactly, right there. So you can see the shaking. That's completely normal. That is something that we want. This goes into hip external rotation. Hey guys, thanks for the likes. We really appreciate it. The likes really help our business out, so please continue to send them.
How many am I doing?
We're doing 10 total.
Okay. I'm good there. Going
Okay.
around?
Yeah, and we're going to do the other side. So Casey, go ahead and flip around. So hold on, wait. You're going to go neutral right here. So your goal is to not break this position.
Got it. Okay.
So go ahead.
Oh,
Yeah.
it's hard.
So don't go about like 25% the height. Yeah, right there. So I basically told her to limit her range of motion. That way she compensates less. Can you kind of feel that, Casey?
Yeah, I feel it.
And it's her left side.
All right.
Thanks for joining in. We are going through her exercises. So let's see. And then the final one is going to be a single leg exercise. So Casey, I'm going to have you stand up. Okay. And then you are going to pretend like you're in a clock. And then you're just going to go like around the clock. Okay? Like from maybe 3 o'clock to 6 o'clock.
Okay.
So take a step back. There you go, yeah. Yeah. So here, we're going to assess with you guys right now, okay? Wait, where's my finger? There it is. If you look at her pelvis, we want her belt line to stay horizontal, and we want her belt line, or we want her vertical line from her belly button to her nose to stay as vertical as possible. We don't want her to break that position or drop that pelvis. And she's doing a wonderful job on that left side. So if you kind of remember when we were testing, her left side was pretty darn strong. We're going to see what it looks like when she goes on her right side.
Feel it in my glute.
Yes, exactly. That's what we want.
Okay.
Okay, so now we're going to go on the... Oh, did you check that out, guys?
It's actually so much harder.
It's so much harder. That's what she said.
And also I feel like, doesn't it look like this?
Yeah, and if you notice her knee, her left knee right here, it's like breaking inward, right? You want to keep that leg as straight as possible.
I'm gonna move forward a little bit.
So hold that position. Just hold it. No. Come back. Just hold that position. Okay. Push your knee into my hand. Right there.
That's where it should be?
That's where it should be. Way harder, right?
Yeah.
So this is completely okay, guys. You'll see her shaking. You'll see her kind of like breaking. That's okay, because that's the point of the exercise. As she continues to do that exercise every other day, two sets of 10 on each side, she'll start to notice that her hips start strengthening. The exercise becomes easier. And her everyday life starts becoming easier, okay? Because all range and all mobility all come together with everyday movements like walking or getting into your car, getting out of your car, going hiking, that type of thing. Okay, so Casey, we went over your hip flexion, we went over your hip internal and hip external rotation. The last thing we need to go over is her posture, her movement, okay? So one thing that we notice in her mobility is that she's hyper mobile with internal rotation on her, okay? So can you go ahead and show us a squat?
Sure.
Okay, you're gonna go ahead and just keep doing squats, okay? So right now we're just kind of looking at her alignment right now.
I was told actually that I have to tilt my pelvis forward for me not to look like this when I'm squatting.
Okay, so she was told that she has to tilt her hip forward. Let's do our own assessment. Let's see what's going on here. She has a camera shyness, right? But if we take some of that away, what I am noticing is that she's shifting to the right, my right. She's shifting this way. Every time she squats down, it's like a boop, boop, that way. Okay? So what we want is we want symmetry. She goes down symmetrically on both sides. The fact that she's kind of deviating like laterally to one side shows the weakness. So we're going to correct her. We're going to show her how to fix it. And then that's going to become her exercise. That's learning the movement. Okay? So we're going to go back into that squat exercise, but this time I'm going to tell Casey, let's drop that range by about 50%.
Oh, so there.
There you go. That's actually perfectly fine. So I'm going to do a little bit of a test here. We're going to check to see her alignment. We're going to put this right against her back. It's going to look like this. Okay.
Can you put this behind me?
Yep. So wait. Look at me. It'll look like this.
Like this?
Yeah. Can you flip this the other way? This hand? Yeah. And then let's try this. Like that. Okay, 3 points. Like lower back, or I mean like your bottom, your back, and then your head. Can you kind of feel that?
Yeah.
Okay. So essentially, guys, Casey, do you want to turn around for us? So I place this linear object. It could be anything. Right now I'm using a cane. It could be a Swiffer. It should have 3 points of contact, okay? It should have your lower back / bottom. It should have your mid back, and then it should have your head, okay? Right now she's making all 3 contacts. When she goes into a squat, she should be maintaining all 3 contacts, okay? So let's go ahead and check that out right now. So actually, do you want to be facing that way?
Sure.
Okay, so we can see the contacts, right? 1, 2, and 3. Okay, go ahead and do some.
Yeah.
Okay, so you're gonna be. There's a chair behind you. You're just gonna like kind of sit into the chair.
Do I take this off?
No. Yeah. So you're just sitting into a chair. That's how to fix it. I'm gonna take the chair instead of like sitting back into a chair. There you go. So her success rate is gonna be like 40, 50, 60%, but that's okay. If she was good at this, there'd be no reason for me to give it to her. So this is gonna be something that she works on. This one she could do it daily, and she could actually do like 50 plus reps, because technically in the world of learning, you need to do thousands of reps to really understand something. This is really, the subject line here is pelvic stability. So, hey guys, thank you for joining in. My name is Dr. Patrick. This is Casey. We're going over pelvic health and exercises. Okay, So, Casey, we're gonna go back into squats now, but this time she's gonna do it facing forward.
Am I putting this behind my back again?
So now we can get rid of it, okay? So this time I want you to pretend like you're just sitting into a chair, okay?
All right.
Good. And relax completely. So guys, as you can see, there's a lot of instability, a lot of shaking. So it's all about intention here, right? When people go automatically into squats, they automatically think, okay, my goal is to lift the maximum amount of weight. My goal is to perform the maximum amount of repetitions, okay? So this intention here is different. Casey's goal is not weight, it's not reps. Her goal is movement. I want her facing a mirror when she's doing this, and literally her goal should be getting every movement 100% correct every single time. If you can do this, I'd say like for at least a few weeks and have it perfect, that's when you start loading the weight. If you try to load a weight and have instability, that's when issues happen. Okay, we're gonna go over one last exercise.
Thank you so much for the likes, guys. If you have any questions, please drop them below and Dr. Patrick will go ahead and answer them.
Also, if you guys have any questions about exercises, if you go to the profile page, we have a bunch of exercises that show you how to treat certain issues like neuropathy, nerve pain, joint pain, muscle pain. Just something for you guys to know. So, Casey, you're gonna go ahead and stand on this. Okay. You're gonna stand on one leg now. Okay. Her goal is to stay as stable, as straight as possible, right? Belt line, vertical line. How she's gonna accomplish this is by squeezing her left butt and squeezing her core like no other. Hey guys, thanks for all the likes, we really appreciate it. Perfect. Okay, and then now we're gonna try her other side, her weak side. There we go. You guys can see the instability. So really squeeze that right hip.
I also feel like a tightness or maybe a pain behind my butt.
So her location is actually the glute med. That is the correct location. She's feeling a pain. What that means is her glute med does not have adequate strength in order to be doing this exercise. So we're gonna regress it. So go ahead and relax. We're gonna come off of this. Do the same exact exercise without the pad now.
On the right side?
On the right side, yes. And do you feel just as much?
I feel it in the front versus the back.
Okay, squeeze your right butt more. And then bring this leg down. Like, don't touch the ground though, just bring it back.
No.
Where do you feel it?
I actually don't feel it.
You don't feel it anywhere?
Well, I feel like a burn.
Yeah, you should be feeling it there. Yeah. Okay. So, relax completely. Essentially, Casey's saying like she's having issues feeling it in the right area. She's feeling it in the front of the hip. That's not where you're supposed to feel it at all. She's feeling it in the side. Questionable, right? Is it the IT band or is it the glute med? So again, this exercise does show that she needs to work on this just to make sure that she's engaging the right muscle. And the reason why this is so important is because if you think about it, walking, running, they all require single leg balance. So if you have a problem with single leg balance and you have instability and say you're pregnant, there's gonna be a lot of pelvic issues and back issues. So guys, we really, really appreciate you watching. We have 6 minutes left. If you guys have any questions, please let us know and we'd be happy to answer any of them for you. Casey, do you have any thoughts about the program or anything you want to tell our viewers?
Yeah, well, I'm looking forward to, you have a pelvic floor program coming out?
Yes, yes.
Yeah, so I'm looking forward to following that. along, and I'm also going to be documenting it on my own. So I'm excited to see what comes from that and how my hip stability will improve. And just my overall workouts over the next couple weeks. I'm going to be doing those 2 exercises that you showed me.
So what's also cool about this pelvic exercises that I'm releasing, if you've ever had problems with incontinence, right? People kind of laugh about it, but let's kind of get over that. Like, let's say you're doing jumping jacks, let's say you're running, let's say you're doing like squats, or like you're at a concert, you're like dancing to music, and then oops, you kind of pee yourself a little bit. So see, it's kind of funny, but it also isn't. It's not a helpless issue. It's a pelvic floor issue. If you do pelvic floor exercises, you can reduce that type of incontinence. And so that's a program that we will be releasing very soon in the future. Yeah, any other questions, guys? And thanks for watching from the Philippines. We totally appreciate it.
Thank you so much. We're here every Sunday, or I'm sorry, Dr. Patrick is. I'll be here from time to time at 6 p.m. and also Wednesdays at 8:30 to 9:30. Dr. Patrick is working out every single day to promote his parent bod program, how to lose a parent bod. So if you have any questions about that, feel free to DM him here on TikTok, or you can follow my account also. Just let me know, message us.
We appreciate it, guys.
Yeah.
We love you, and we'll see you next week.
Have a great week.
Bye.